Beyond these walls are people with a story to tell. Here compassion, creativity, and hope flourish. We are proud of the patients we care for, and we are open to what they can teach us. People from all walks of life come together with a shared purpose. At Nuts Healthcare, we are committed to making a difference. This is our workforce, and we are Nuts Healthcare.
There are moments that matter every single day. It's the little things that make a difference, especially to people who are homeless or vulnerable or face disadvantage in some way. I am as passionate today as I was 20 years when I first started working in service, and I'm really proud to do what I do.
It was that moment, those 5 or 10 minutes that we took to just sit and listen. We didn't say anything revolutionary. We just had a conversation. Just the relief in that person's face, the thankfulness for giving our time. What was 5 or 10 minutes in our day was the world to them. It's a very small impact, just 10 minutes of our day, just listening and saying, it's okay, I hear you. It was the difference that made.
Having that voice directly from young people is so important to making sure that them voices are actually heard, and not just heard but listened to and acted upon.
My work with the staff team resulted with the service user going into his shop and ordering a prawn sandwich. And for us that is such a small thing, but for him, the smile on his face was just, it was just huge.
Moment of joy, it comes through the phone straight away. You can hear a smile from 100 miles. It's absolutely fantastic. One of those, during the working day, it can turn a day of normality into something really, really beautiful. You're being part of a much bigger journey for them in their life, and that's a really joyful thing.
Together we created an atmosphere where patients, staff, families, friends could relax, connect and celebrate. It made me feel I was not in a hospital, and it made me feel freedom. It was a reminder that joy and community are an essential part of recovery.
I've been involved in a co-production project developing a training package for ward rounds and CPA meetings. This initiative has empowered patients to chair their own meetings, growing confidence and take ownership of their care. Moments like these remind me that there are people who truly care, who show compassion and who believe in the power of the patient's voice.
After a really serious incident where a patient harmed herself, I went to sit with her daughter. She was terrified that her mum wouldn't live. She was terrified about her coming back into our care. She was desperate and she didn't really know what to do. She was thrown in, she had no control, she didn't know where to turn. And we just sat and I listened and I supported her to know that there was light. We built a relationship over time, and in time that trust that we built helped her rebuild the trust in our organisation, as her mum was going to stay in our care and would need our care for years to come. Her daughter had no control. However, we gave her an opportunity to ask questions and be really listened to. We supported her with compassion and kindness. It's a real privilege to sit alongside families where something really awful has happened and it's the worst time of their life. And that's the reason why I do what I do as a family liaison officer.
I recently met a family member who was exiting a taxi with 3 bags in a suitcase outside one of our hospitals, and I went and offered to support her to go onto the ward. During the walk to the ward, we discussed being a carer and the challenges around what it's like to have a loved one in hospital or in the community, and that feeling of isolation and helplessness. It really resonated with me as I'd recently been a carer for my father before he passed away. That moment really reminded me around why I came into nursing. It was really to care for people, with offer compassion, but without judgment.
So yeah, that's why I love my job. I just feel like instilling hope into people is just an amazing thing.